Good afternoon and thanks for joining us. I'm Judy Simpson. Education about breast cancer is one of the most important tools in fighting the disease. So today, as part of our ongoing partnership with Vermont Cancer Center of UVM and Fletcher Allen, we're going to learn about the risk factors for breast cancer and an important program for women called the High Risk Breast Program of Vermont. Joining me is Dr. Marie Wood. Dr. Wood is the founder and director of the High Risk Breast Program. She's a medical oncologist at the Vermont Cancer Center and a professor of medicine at UVM and Fletcher Allen. Also with me is Tiffany Rounds. Tiffany is a research specialist in the College of Medicine and the research coordinator of the High Risk Breast Program. Thanks so much to both of you for coming in. Let's start out talking about what is the High Risk Breast Program of Vermont.
Well, as you've already identified, it's a mouthful. The High Risk Breast Program is meant to be a clinical program which focuses on assessing women's risk for cancer and then making the best screening program for them. I have to say, I'm not the founder of the clinical part. That was really in existence long before me. But then in 2003, we did bring in a research focus to that, where women who are at risk can be part of a large database, and then those women can actually contribute to additional studies and or enroll in additional studies.
So what kind of research is being done?
The research that we do, I think I'll let Tiffany talk about how a woman would enroll in the program, and then we can talk a little bit more about the research.
Okay.
So the research program does bring in both aspects, the clinical as well as the research part that I'm in charge of. Women are followed in the clinic. We use medical records, as well as visits with me include a blood draw as well as questionnaire completion. And we bring all of that data together, storing blood in a freezer for an indefinite amount of time until we're using it later, in conjunction with that clinical data, as well as questionnaire data about physical activity, screening practices, diet history, a variety of things. That's all brought together for the research component.
And so what's the impact for patients here in our region and maybe more broadly?
I would say the impact is a couple of things. For women who are enrolled in the High Risk Breast Program, we send out a newsletter anywhere from 1 to 4 times a year that tells them the progress we're making in the program, that makes them aware of ongoing studies that they're doing that they might be able to participate in, and also gives them a little bit of information about new risk factors that we find out about or something like that. So we try and educate them. The impact, I think, is also that women are really providing a tool to help us collaborate with others. We're building a bigger collaboration with people across the country because we found that our database here in Vermont, which encompasses women from this region, collects the same information as a database at MD Anderson and Columbia. And we're going to look forward to really building that as one big program and looking to see if we can find things that are associated with risk for breast cancer or maybe non-risk for breast cancer. And that's really the impact for those women. They get clinical screening and then they participate in research to help us learn more about risk factors for breast cancer.
And in turn, they're learning more about themselves.
Yes.
And so in general terms, what are risk factors for breast cancer?
So there's a variety of risk factors. We've tried to break them down and simplify them. People hear a lot of risk factors like taking hormone replacement therapy and things like that. I've left those aside. Family history is a big risk factor that we focus on in our database. So women who have one of these cancer-causing mutations, or they have just a family history, especially with early onset breast cancer, does put them at increased risk, moderate, and or high risk for breast cancer. We've heard a lot in the recent press about breast density, and so women, especially older women who retain breast density, whose breasts stay dense, puts them at high risk for breast cancer down the road.
What does that mean, dense?
Dense, we really don't know. That's a great question. But what happens is when you do a mammogram, if you don't have any dense tissue, just have fatty tissue, you can see through and you can easily see changes. If you have a lot of density, it probably is the tissue around the ducts that's contributing to that, and it makes the mammogram look white. That makes it harder to read, but separate from that, it's also a risk factor for cancer.
Okay.
We know that lifestyle factors contribute, such as being overweight, especially after menopause. Alcohol use is something that people talk about a lot. Women are recommended to have, depending upon which country you live in, 1 to 2 glasses of wine per day. So it's really about moderation, making sure that you're getting the right diet and things like that can protect you, but not doing those things is a risk factor. One risk factor that people don't commonly think about is if they get a biopsy result, say they have an abnormal mammogram and they get a biopsy and that biopsy shows atypia, that puts them at pretty significant risk for breast cancer down the road.
So it's just not a normal biopsy?
Not a normal biopsy.
And that can be a lot of different things, maybe?
It really is 2 things that you might read on a pathology report. It's atypical ductal hyperplasia, atypical lobular hyperplasia. Those are the kinds of things. So if you see that word atypia in your breast biopsy, that's something that you should ask your doctor more about.
And so who should consider joining the high-risk breast program?
We invite women who are at moderate and high risk for breast cancer. Those include women with those strong family histories of breast or breast and ovarian cancer, especially if it's earlier onset. If you have one of these genes that we know is associated with risk, BRCA1 or BRCA2, or now there's more genes, those women are eligible. Women who have these biopsies showing atypia, or women who've had previously been treated for Hodgkin's disease and have had chemotherapy and radiation therapy are invited to participate in the high-risk database, in the research part.
And so let's just talk about what someone should do if they're interested in joining the program or learning more.
So if they are interested strictly in trying to understand their risk and maybe meet with a physician or a nurse practitioner to discuss what kind of risk factors they have and what kind of surveillance they should be participating in. The person that they would want to contact is, her name is Lauren Driscoll. She works over in the Breast Care Center at Fletcher Allen. Usually that's a great place to start. Make an appointment to see a physician. If they know already that they fall into one of the high-risk breast program categories, they are welcome to call me. I am the program coordinator working at the University of Vermont. My number is 802-656-8502. And we're also working on building our new website. It will be we're aiming for later this fall. But so right now, if you Google high-risk breast program, there's a few broken links, but we'll have something up soon.
And so what's required again from the patient? What can they expect?
So as far as the research program meeting with me, they would give a blood draw sample, and we would complete some questionnaires in clinic, and then I would send some home.
What are some of the questions that you ask?
It's kind of a variety of things. We do a 7-day physical activity recall, so they'll think back to the past 7 days and fill out questionnaires.
I'm trying to think how easy that would be for me.
It's questions kind of how many days in the last 7 have you exercised at a moderate level, and it will give examples of what a moderate level is. For more than 30 minutes would be a great question. We also do a diet history questionnaire. It's a little bit lengthy, but it's a great tool to understand sort of what we understand that obesity is potentially a risk factor. So what are the habits of people in different weight categories, and what are they eating or not eating? Trying to understand that. We also look at, again, the family history of not just breast cancer, but all cancers. And then surveillance tactics. How often are you getting a mammogram? How often are you seeing a provider? Do you have insurance? Trying to understand some of those background issues for healthcare in general, not just breast cancer.
Yeah, I mean, it sounds like it'd be a pretty good idea for everyone to kind of think of these questions.
Absolutely. And we do follow up with them. We follow up at 4 years and 8 years, trying to get some longitudinal data. And it's worked out great. I've done it for about 2 years, and really the patients love participating. For a lot of them who know that they're at increased risk, it really makes them feel like they're doing something. They're at least providing data for the research community and trying to better understand that prevention and screening.
What if you don't know about your family history? I'm adopted, I have no idea.
Well, that's actually an excellent question, and it's a little hard. Sometimes if you're adopted or we don't get good family history, we end up trying to help patients move forward. We then add other risk factors, so we might look at those other risk factors that we talked about. There are other lifestyle factors that you can incorporate. And if you don't know your family history, ultimately, we don't assume it's bad. I think that's difficult, and it's probably a bigger question because now there's so many different guidelines about how you should be screened. So for people like you who don't know their family history, which is really the biggest risk factor for breast cancer, we might advise that you think about really making sure that you're doing all the right things, and maybe you should be screened a little earlier than some of these guidelines that are saying wait till 50.
And so what about support for this program?
We are hoping to get more and more support. We've recently partnered with Lunigs, who hosts the Evening of Wine, Women, and Song on September 8th at 6 p.m., and that's going to provide us with some support. That will be our community support. We work hard to get research support, and we're doing a lot of projects right now with the blood that we've collected from women over time to look at those things, and that's what we're using to get NIH funding or other foundation funding.
There's also a familial cancer program?
The familial cancer program is sort of under but a little bit separate from the high-risk breast program. That is for people who think that they might have one of these cancer-causing mutations, BRCA1 and BRCA2 being the most common. And that's a separate evaluation for those people who want to think about genetic testing because they have such a strong family history. The high-risk breast program is much broader than that. That's just a small piece.
I know coming up this fall, October 10th, is the annual Cancer Center Breast Cancer Conference. Why is that such an important conference?
I think it's really cool because it's a big partnership with the community, and we've worked hard to make a focus not just for cancer patients, but for their supporters and for their relatives who also may be at risk. So if you have cancer, you can go, but if you don't have cancer, but your mom or your sister has cancer, you can take them and support them, but also learn about your risk for cancer.
And once again, maybe we can give that contact information if people are interested in finding out more about this.
Yeah, absolutely. I'm happy to point anyone in whatever direction, either give more information about what I'm doing through the actual research program at the University of Vermont, or I can help point them in the right direction of whether they would potentially be interested in seeing a physician. Again, my name is Tiffany Rounds, and I'm the research program coordinator. You can see the number there at the bottom. You're welcome to call at any time. The number is 802-656-8502.
Well, I want to thank you both for joining me today. It's a very important topic and really a chance for women to sort of be empowered, I think.
Yes.
Yeah.
Thank you for inviting us.
Thank you very much.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.